Hi, everybody. I am Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well. I'm going to walk you through this case. I just re-logged back onto here. It should hopefully be working here for everybody, and I'll wait for everybody to join us. But this is a really, really cool case, and I'll walk you through it, how I did it, and just kind of chat a bit. Today is just, it's my last day for the week for streaming, so hopefully I'll be able to touch base on a lot of people's questions that they had over the last few days, and then we'll answer a little bit more about this particular case too as more people rejoin us here. So let's see. Oh, here's Diamond. Diamond, good seeing you on again. You were asking about subcision. If you could just repeat that question, because I lost it as I had to come back on. I saw that you said you were terrified of subcision. Was it the pain? I missed what was said there at the very end there. If you could, that'd be really helpful for me. But yeah, so those just joining, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars. And this case is something I did a lot with this whole week, actually. We did a lot with this case, these kind of cases with rolling scars, with a lot of fat destruction. These kind of scars actually do see a really nice result pretty soon, pretty quickly, actually, a matter of a few months, sometimes 6 months or so. You'll start seeing a lot more improvement. Because with these patients, it's interesting because a lot of it has to do with the way you do subcision. If you could break it up really effectively, it's going to look a lot better just from that. And then, of course, doing volume replacement is going to help a lot. And then we have to do also laser resurfacing as well. So that's a few different steps here, which ended up working very, very well for this patient. And then we also did TCA Cross. So this was done in this particular case so far with 2 steps. And then it ended up when he came in again, just doing a bit more for TCA Cross. And then we'll see him again at some point, and we will work on probably a little bit more for laser and some more volume replacement. So I'm really careful with volume, especially in like the mid-cheek area. I go pretty slow with it. I don't want to overdo it at all. So it's a process that we'll just kind of go slowly and slowly and slowly to re-expand that tissue. And there was a lot of fat loss here. You could look and see his mid-cheek was just destroyed from his scars. And it's like over and over again, those are things that we see with rolling scars. With a lot of scar tissue, there's that fat loss. And one of the big things that I do is I do a lot with volume. And it's a slow journey, but I think that aesthetically we could get it to look really nice and really natural. But it's really critical for a lot of patients. There's no way of just resurfacing this. This is a patient who's Fitzpatrick 5. He's a darker Hispanic patient. And even if he was lighter skinned, actually, there's just no way of just going out and resurfacing this. You would never be able to get much improvement there. So Jackie, this is with 2 steps for this particular patient. Scars, what to do. Harmony's asking what to do about the scars. Well, what kind of scars do you have? That's the question. If you're like this is what I did here was subcision. I did some TCA Cross. I did laser resurfacing. I did a volume replacement. So those kind of scars, that's what we did. It seems like you said you have surgical scars. Surgical scars are very different. Sometimes you need surgical revision. Sometimes it's just like, mild type of scarring, and we may have to work on the texture with a little bit of a laser. Usually on the body, I prefer Erbium laser so I don't overheat the skin. But if it's thicker, we may need CO2 laser. And then if there's like redness or if it's pigmentation, then we have to use other lasers. So it just sort of depends on what's happening there. How do I feel about peptides? Well, I think it's like a catch-all term. I'm not entirely sure, what they're referring to. Peptides, it's just like, it seems like it's just sort of a bit of a trick sometimes because it's really not specific to me. So I'm not entirely sure what it is. It depends on, what kind of peptides and what it's for and if you really need it or not. Diamond Curls is saying, very scared of subcision. I have mostly ice pick and boxcar scars. Can lasers help? Not expecting perfection, just improvement. I tried microneedling and I feel like it only made the scars worse. That's interesting that you said that. Today I had two patients today that were saying that they were shocked that first of all, they're so concerned, they're so nervous about the fact that they thought I was going to do subcision or thought I was going to recommend subcision. They're saying that was the thing they were so scared about, but they didn't need subcision, so I didn't recommend it. They're like, oh, thank God you didn't have to do subcision. And then I had other patients today who were so worried about it before I did it. I had to do subcision on them. And they're like, this wasn't bad. Actually, those patients patients actually let me share, and they're going to actually showcase their journey eventually. But it's kind of interesting, you know, they're like saying that like, oh, this was not as bad as I thought it would be. One of my patients, I'm going to be doing the phenol peel next week on her, and she has very deep, thick scars. And like, she was so worried about this. She came all the way from Seattle, flew in just for the subcision part. And she was just like, this is the part that I was really scared about the most. And it's like, it wasn't that bad. She's just like, this wasn't bad at all. So, yeah, you know, it turns out actually a lot of times I don't have to do subcision on certain kinds of scars. And when I do have to do subcision, it's really going to be okay. I will walk you through it. It's going to be okay. There's a lot of numbing there. Faraz is saying, is the volume permanent with Sculptra, or is it like a filler that you need to redo? It's more of a biostimulatory product. It depends on how much collagen your body produces, but it's certainly not a permanent product. There's other options potentially like Bellafill, but there's so much fat loss in this case, so much volume loss that I had to do something that gives a little bit more volume, and Sculptra would really help. It was originally really made for HIV patients initially, and really they don't have great fats, and so it's like essentially I'm talking about like patients before we had a really good therapy for it, and essentially they wanted to do something to help with the significant amount of fat loss that was occurring. So the initial FDA approval was really for HIV, AIDS, lipodystrophy, and you could see actually that there was good volumization. But yes, you do want to do that again. And, you know, possibly we may have to do other options like Bellafill for more permanent things, but nothing, you know, you're still going to lose your own fat. You're still going to like get older. So volume is just like, that's how it is. It's just, you got to keep up with it. But Bellafill is like a very, very excellent long-term solution. That's what I used on my own face. It's you know, I love it because even if my weight drops a bit, it just stays there and just like, it supports the scar tissue. But certainly if I lose a little bit more and like, or my own fat gets, you know, absorbed more as I get older, and it's maybe that like I have to do a little bit more at some point, you know, and that's okay. Like that's just like the normal natural aging process. And I'll do a little bit, a little touch ups there. But like I found that really for myself, you know, I'm almost 43 years old now, and it really was something that reversed a lot of my aging. Like it just really was. So like that's why I recommend it. But there's a lot of options, you know, but biostimulatory option is definitely my favorite option. Faraz is saying, I'm actually excited about Subcision, the popping sound of breaking the scars. Yeah, that was my patient today. She was saying that like it was actually like exciting and cathartic every time I was breaking it up. Actually, one of my patients today, she was saying that, which was really, I appreciate it actually, because that's how I feel when I do it. You know, I feel like it's cathartic. It's like I'm breaking up all this. And, you know, people will say that they felt like I am breaking up their trauma. There's a lot of trauma. There's a lot of trauma with it. And actually, the last couple of days, I heard people say that same thing, that like this was stuff that was like, they know when this happened, they know how it happened, they know the cystic lesions. Like people are very familiar with their face. They know where I'm like breaking up that scar, and they know exactly which one it is, and it like is a release when it's gone. It's like it's broken up, and it's really satisfying. Yes, how's it going, Resin? How's it going? Yeah, it is a release. It's super satisfying for myself actually, and like I like it because it's like I find that I'm finally getting revenge on scars, you know, and something that wasn't properly treated. I really do feel like it just wasn't treated properly by so many people in the world, and it was just and it's just such an unfortunate situation that there's so many people that were suffering for so long with this, and just like you know. It's sad, you know, and I'm like glad that I'm here in this position where I could look back and think to myself that like I wish this was available for myself, but at least we could do it. At least we could do it over and over and over again. But you gotta go through this process. Look at this volumization that we had to do. There's no way of getting this kind of result without volume. That's what I wanted to showcase for you guys. Pivotal Times is saying, oh, hi there, Dr. Qazi. Hi, Pivotal Times. How's it going? So Moen's saying, when do you have availability for online consultation? So just go through at drqazi.com, and we'll be happy to help you out with that, actually. Just go through drqazi.com for that, and you can schedule the virtual consultation directly that way, and then our team will just set it up for you. Max is saying, hey, Dr. Qazi, how good is Ultra Pulse laser for acne scars, and is it safe to use hydroquinone for someone who has family members with vitiligo before the procedure? I actually don't use hydroquinone for my scar patients. I don't use it. I do find that there is more risk for hypopigmentation, or as prolonged hypopigmentation, I should say. And I'm reading on multiple platforms, Norma. So there's a lot of different platforms that I'm on actually at the same time. So there's a few different questions on a few different things. So I wish at some point everything was just compiled on one thing. These guys are all fighting with each other. So it's not the case, but not you guys. I mean like the social media giants. And I can't even like name the names of like the platform that I'm reading out of, because like they say that then they like ban me for like a month. So I'm not like going to say like which platform, unfortunately. But you can see like of the platforms I'm on, you can see search my name and you'll see it on there. I would see here, Lancaster saying, I was wondering at what age cystic acne becomes definitively scarring and when to initiate Accutane. Well, if you have cystic acne, you should treat it really rapidly. Try to get that under control so it doesn't lead to scarring. And it's really, really critically important. It's not that you have to do isotretinoin per se, but if it's like relentless, if it's something that's not being controlled properly, then really you should strongly consider being on something, stepping up the medications. And yes, you may have to be on isotretinoin or what we use over in our office, which is the Accure laser as well. So we do either of those options. It works just like Accutane. So that's what we end up doing. Oh, hi, Nemi's asking, hey, Dr. Qazi, can you explain what the micro laser peel is? Oh, awesome. Yeah, so that's actually what we do is low heat, low energy laser. That's an erbium laser. And what we're doing is actually just taking little bits of your skin. And it's awesome because we can fully control the energy that we're providing over there for that surface and just taking little bits of it. So if you ever want just like little layers of your skin taken off just for like a couple days, and that's what it is, just like a couple days of downtime, it's like an awesome way of doing that. And it's like one of the best ways to exfoliate. People, like one of my patients today, she was saying, what are the skincare options I could do? Like, do we have a skincare brands? But like nothing is gonna beat lasers, and and lasers really just like every 6 months or so is like incredible. Or if you have a little bit more pigmentation, you could do it, every 3 months or so. But it's like just nothing beats it in terms of like the overall skin quality, the way it looks, the brightening effect. Nothing beats that. So that's what I love to do actually, like low heat, low energy lasers. Really, really love it. And, even for cases like this where I do like more precise like heat or like fully ablative in certain areas, I don't use that kind of energy throughout the whole face. So I do like it so that things look evened out, but I don't do like high bulk heat there. So that's how I end up doing. Sarah saying, hi, someone recommended for me to get laser genesis. Are you familiar with this procedure? Yeah, I used to have it. I still actually have a device. The XLV has the laser genesis thing on there. I honestly never use it though. I guess what's the question? What are they trying to treat it for? Hopefully not for scars. Before, back in the day, that's what they were telling people to do it for scars. I think the company went bankrupt though. It did actually. Which, I think their XLV is good, but sometimes things were just overpromised stuff for certain things. Norma saying, does PRP help with closed comedones? Not so much. No, it's not going to help too much with that. PRP basically is platelet-rich plasma. It's full of these growth factors, nutrients, and you're going to be able to get a little bit of extra blood flow to your skin or like to your scalp. It's really good for just basically helping with hair growth. But it's not really going to do much at all for pores, which is really an oil production issue. It's not really going to do much of anything for scars other than help with the healing process. So it doesn't do much with that, though, otherwise. Let's see. Yuan is saying, hi, doctor. I have my next scar appointment coming up soon with you in a few days. I have a few cystic pimples that have come up recently, maybe 3 to 4. Is there anything I should do about them before? Skin is pretty clear otherwise, though. Well, yeah, we can help you out with that. Just give us a message, send us a message over. We could take a look to see if it's something I need to see you about or something we could take care of. Let's see how we could do it, though. Just send us a message and we'll see how to help you. Sella is saying, which options to improve scars that don't include lasers? So a couple days ago, I showed a result that didn't involve lasers, which involved me doing subcision and volume replacement. That patient didn't have like the thickness around the scars, so I didn't have to do lasers for that. But, I still did TCA Cross, which is an acid I place at the base of the scar. So it's not that you have to do lasers, but it depends. Like if your scars look like this, where it's thicker, then we may have to do lasers there. If it's boxcar scars also respond really well with lasers, especially if they're more superficial. It's a really, really good option, actually. You could cut it down really nicely there. Rhino is saying, is there a sunscreen specifically designed for people with hypopigmentation? Not that I'm aware of the particular one, but you could actually do anything with titanium oxide. Especially, it's going to be really, really helpful to really just block UV damage, further UV damage. So consider actually something like I showcased earlier before is Mesoaesthetics. It actually has a very high concentration of iron oxide in it. and it's got a bit of a tint to it too, so that'll cover up a bit of that hypopigmentation. Laurie is Leary, or I guess it was Larissa. Larissa, sorry about that. Should I go on Accutane before I come to you for help with scarring? You should get your acne under control. You should definitely get your acne under control, whether that's with Accutane or anything else. We could take a look to see, but you should get it under control. How about the Cure system? Do you recommend? I heard it's derm approved. Yeah, I don't know if you know how the thing about derm approved. I don't know. Does it actually say it's derm approved, or if it says it's like dermatologists have approved it? But just so you know, like they, no matter what, they'll give like these, not necessarily not necessarily talking about this particular brand, but let's just say that other brands and potentially this one, they reach out to a lot of physicians who have social media presence, and or like just like send over like any dermatologist or so. They'll send over like a kit, and then they'll have like a questionnaire, and you could answer the questionnaire and say that like, this is something that you would recommend, and now it's like basically a dermatologist has approved it. It's like, they gave something for free, and then like that's what ends up happening. That's why I just say I'm unsponsored all the time. Like I'm just like totally unsponsored really because of this. Really, it's just like I just can't stand this whole world like this. I think that they turned a lot of these doctors into QVC spokespeople, and they're really talented people. And like I get it. I know that modern state of medicine is just like really, really terrible. I know that that's the case. Like I understand it. I understand that the way this world is like private equity is like controlling these derm groups, and they're making it so that you have to do these biopsies, and you can't really manage like patients the way you want to manage. And I get all that, but like at the same time, it's like it's kind of like unfortunate that they essentially made physicians into like these spokespeople for random like brands like this all the time, or whatever else is out there. It's like, I don't know. I don't mind like stamping devices in general, but like I think it's definitely questionable some of the claims that are made, things like that, and especially like the things that are inside there it could be reactive for the skin. I just don't really understand what the concept is, and especially why physicians are like putting their name and their license for these things. Sometimes I know it's money, I know it is, but like there's other ways to make money. There are, or just like whatever, about the money. But you'll see this whole industry is like this. The whole industry is full of it. The whole industry is just like, it's like obsessed with like getting things where people are just like, obsessed with getting brand deals. That's what their whole goal is. The whole point of this is to be able to like get speaking engagements and do all that stuff, and be sponsored by some corporation. And I don't understand why you want to do that. To me, I'm not sure why you would like want to do it, but it is something I could judge people with, though. It is because it's like I just don't get it. Like people need and care about money, but there's no reason why they should be telling people like yourself that, oh, this is derm approved or something like that. That's just like very upsetting, actually. And then they're sitting there making it seem like this is something that's superior to other things, and it's like clinically it's not. And like a patient the other day, actually last week, she actually sometimes is on here. I don't know if she's on here right now, but she was telling me she spent, I think $3,000 to $5,000. I forgot how much. It was $3,000 or $5,000. She was saying at a dermatologist's office for her scars, $3,000 to $5,000 on skincare products. Not like the treatment, the skincare products. The skincare products are $3,000 to $5,000, and it's like it's wild. I don't know how this is acceptable. This stuff is like just over and over and over again. That people are just trying to tell you and look you straight in the eye because they spent a lot of money on their own skincare line, and they're pushing this as if this is something that's going to help with the scars. And none of this is the case. It's not the case. I don't use that stuff. It's not, and we could do this over and over again safely in skin types that are darker than their types. And clearly, it's not about that skincare. It's about how you're doing things. It's about everything else. Skincare just has to be simple. It's like, don't overcomplicate the skincare. A lot of these guys just never had acne, never had scars. It's very obvious, and they don't understand what the process is. They think that you should overly exfoliate your skin. If you have acne, I think that's terrible. A lot of people grew up with like the St. Ives, apricot scrub garbage, let's say the scrub type of thing. I don't even know if they're around. Maybe they're not even around. But like the physical exfoliating type of stuff for acne. And it then there was also like this big movement to like just overly dry your skin with like really high dose of retinoids. And it ended up just like being this problem where people would just end up getting really excessively dry skin and they were still getting breakouts. It was like this really frustrating cycle that I was really involved in, like constantly. And I was just constantly told over and over again that I had to just increase my retinoid dose. I had to do more with antibiotics, like oral antibiotics. I had to do this and this and this. And like just none of that stuff was helping really. And it was like clear that a lot of stuff was just missed. It wasn't about like that stuff. It wasn't about like any of that. Just keep it so simple with like the basic moisturizers. You could do a retinoid, but just do low dose of that. Norma is saying, how can I get rid of closed comedones? I've been using Differin for a few weeks, but I'm impatient. Well, it's going to take a while though, unfortunately. It's going to take a long time. Differin is just an over-the-counter, which could help a bit, but you may need to see someone to prescribe you a higher dose retinoid and slowly start going up on that if that is something that is concerning you for you. But closed comedones usually is just an oil production issue, so you could do that. And the other option, if you really want to do something to control it, is like low dose of Accutane. Microdosing Accutane could help if you're the right candidate for it. That may be an option there too. What's your opinion on peels versus lasers for PIH? It depends on the kind of peel, but a lot of times I think it depends on also the depth of the PIH. If it's more superficial, which most of it is, a lot of times I hear someone say, well, it's dermal PIH. Not quite really. A lot of times it is right there. It's darker. It's on the surface there. And yes, like topical creams, things like that could help. Peels could help. And then the Pico laser, actually, we could do it even just right on the surface. Like the PicoSure laser, 755 wavelength is excellent for that. But if we need to go deeper, we could go deeper too. We have wavelengths that go deeper. It could penetrate some of that pigmentation deeper for dermal pigmentation, dermal PIH. 1064 Pico works very, very well. So it's a little bit deeper. It'll have less heat, less energy. That could work out too. Jackie's asking, when we do a consultation with you, do you prefer in-person or online, and do we get the total? Yeah, you get the total, actually. You do get the total. We do either. Most of my patients are from out of state, and so I do Zoom calls all day long, and I have no problem with it really at all. I don't do just like on the phone, though. I don't really like that. I'm actually more of like a face-to-face type person in general, so that's actually why I like this type of thing, just talking, because I don't really like just like talking on like a radio type of thing or anything like that. And so, yeah, I like Zoom calls are totally fine. I'll circle your kind of scars, zoom in on your scars, and really showcase exactly how we treat each thing that you have there, and really hone it in for you. So when you come in, it's not going to be a surprise. Moni is saying, is it good for dark skin? Well, we did this on a darker skin type. This is a patient. And someone else is asking. Honey is asking, do you work with dark skin? Most of our patients are dark skin. This patient is Fitzpatrick 5, actually. Most patients are darker skin type. I do a lot with Hispanic patients as well, a lot with African skin tone, a lot with melanated skin in general. And someone earlier was saying that they were surprised that, I'm comfortable doing Korean skin types because so many people that they've gone to have had so many complications with that particular skin type. They basically make it seem as if it should be higher heat than it should. And I understand that skin type very, very well. I know that you really have to be very, very careful with lasers and energy devices. You got to go low heat, low energy there. How do I treat acne on the jawline and neck? Good question. I mean, that's actually, I'm not sure if you're male or female. If you shave with, let's say, electric razors, that actually could cause more friction, which could end up causing it to get really inflamed. Sometimes it can even lead to keloids. So be careful with that. You should actually also consider something that's going to prevent friction at nighttime. So think about like silicone tape. Actually, that could help you out too. And then on top of it, you may want to do something where you do just something to control oil production around this area. So do tretinoin and consider something like a topical antimicrobial. And also just like something that's just like sulfur based, which is like dapsone, works very, very well. So consider that. Let's see here. Maybell is saying, this is Cynthia. Hi Maybell. Zaina is asking for my answers to be shorter. I'm on here like Monday through Thursday, so if you need me, I can answer that, or you can schedule a consultation. I'll be happy to help you with that. But I saw that you're asking how many sessions in this picture. So this was with two different things. First step, I did subcision, where I went underneath the scar tissue, broke up the scar tissue. And then I did TCA Cross. I did an acid at the base of the scar. I did laser to resurface the edges of the scar. And then I subsequently did some Sculptra here for this patient. So that's how we ended up doing for this patient. And eventually we'll do a little bit more laser, and we'll end up doing a little bit more, just a TCA Cross and so, and probably some volume replacement. I appreciate you, Sailor Moon. Thanks for coming on too. Cookies and Cream is saying, which filler would you use on indented glabella frown lines? So sometimes you do Subcision, and then sometimes you do a lot more with like Botox. You don't necessarily have to do actual filler in that area. You don't actually necessarily want to do filler in there because of the movement that occurs there. Take Control USA. I'm not sure what that's about, but Take Control USA is saying, which might be better to treat deep wrinkles and old acne scars? 1 session of Fraxel ablative CO2 or 5 sessions of non-ablative Fraxel Dual 1550 and 1927, or is there something more effective? That's a good question. It's really about what kind of scars that you have. Really, that's what it comes down to. What kind of scars you have. If the scars look like this, it's not going to be about lasers. You can see in this case, we ended up doing Subcision, breaking up that scar tissue. And then we ended up doing volume replacement as well. We did laser to resurface the area, but it's not that we did just laser. Laser is like part of it. Laser is not the main thing. Laser is like a part of the story because I had to do it for the thicker edges of the scar, but it's not like the only aspect of it. So to answer your question, it's really, is he saying you can't hear me? It seems like people should be able to hear me. It looks like everybody can hear me. Let me know if you guys can't hear me. Can you hear me? So it doesn't matter about about the laser. You have to actually go. A lot of it is the manual procedure, the things to actually break up the scar tissue. Okay, awesome. Thank you. So why do you ignore my comments? Because I have a lot of comments, a lot of questions. I'm not purposely ignoring it. I try to answer everything. I'm on here Monday through Thursday, and there's a lot of questions. And sometimes like I already answered it, and then I want to go into like something else, or there's other things I want to talk about. Or it's like, I'm just going to relax and talk about something else that's on my mind because it's just like freestyle. Brianna's saying, do you recommend Aerolase or microneedling for scars and hyperpigmentation on the face? Not so much, no. I think that's a jack of all trades laser. It really is not going to be the best, honestly, for that. So I would not recommend Aerolase, and then microneedling, not going to help really for either the scars much, like scars be very mild, and then hyperpigmentation is definitely not going to help much with that. Okay, so is there anything to help with KP? Yes, you could try. The easiest thing to do is try something with urea. So try picking up something with urea and use that. I think that's like the thing that actually a lot of people haven't used, actually, urea. Try that for your KP before doing lasers. It actually just works really well. You'll see that a lot of times actually people come to me to think that they have to do lasers, then I put them on that, and it's like, it's only like $15 or something like that, so just like get a urea cream. There's like Eucerin has one. There's a few other options out there, but just like start with that, and you'll see that there's going to be like a lot, like rough and bumpy especially works out really well. But there's a bunch of options there. And thank you, Sailor Moon. Thank you guys so much. I will wrap it up tonight. I will be back on Monday and to answer people's questions about radiofrequency microneedling for ice pick scars. I would not recommend it. I don't think so. Let's see. Teddy Bear saying, Dr. Qazi, I went last week for laser and I can't wait to see my results. Thank you so much. I appreciate you. Thank you so much too. So hopefully we'll be able to help you guys. Let's see here. What's going on here? Yuna is saying, I noticed my scars definitely look shallower after Bellafold, but I'm still dealing with shallow yet harder edge scars. I hope to knock it out. I have TCA Cross coming up next and already did laser. Would another pass of laser be in the cards? I did fractionated last time. Yes, especially if you did well with the laser, I'll be happy to help you out with that. But it sounds like you may still have a little bit of oil production. So let's think about that because it sounded like earlier you're still breaking out. Let's see. Maybe we have to control the oil better before doing that, though. Let's see. Yeah, absolutely. Anyways, thank you so much.